Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. In this episode of the Knee to Know Show, we're going to talk about hip pain after knee replacement surgery. Why do you get it, and what can you do to manage it effectively? Hey everyone, so today we're talking about hip pain. So pain in the area and region of your hip after knee replacement surgery. We're going to talk about why you get this and why people commonly get pain in their hip after knee replacement surgery, and what are some ways that we can effectively manage this pain and discomfort and what we can do about it to help it go away and help you feel better. So hip pain after surgery, after knee replacement surgery, actually is a pretty common thing. You hear about it quite a lot, and there's probably definitely a lot of reasons for it. So this can be pain in the right side or the left side, so the same side you had surgery or the opposite side you had surgery. It can be that pain that's on the outside part or that lateral part of your hip. It can be pain kind of deep within the hip joint itself or within the groin area, or it could even be that pain kind of in the back part, in the glutes and the posterior part of your hip. Very common to have, and something that can be effectively managed. But so why do we get this pain in our hip after knee replacement surgery? So there's a lot of important ways and a lot of reasons this happens, but if you think about having a knee replacement surgery, this is going to change and impact a lot of things that are going on, of course, at your knee joint. So you have swelling, you have pain, you have stiffness, so you have decreased motion, range of motion, you have weakness, muscle weakness in the muscles around the knee joint. You have a lot of different things going on. And what happens is your body itself is a chain. It's a link of chains. So it's very interconnected. So if something changes at your knee joint, such as your range of motion, your strength, you have pain and discomfort, and you're moving that knee a little bit differently because of this, this is going to affect and impact the other parts of your body, especially the things that are more proximal or closer to your knee. So your hip is obviously very close to your knee joint. So having something going on with your knee, such as decreased motion and mobility, is going to affect your hip joint probably a lot more than it might affect, say, your shoulder or your neck. But everything is interconnected chain. So, for example, let's think about when you're walking. Probably the most common and the thing you're doing the most throughout the day is walking. Well, when you walk, you need a certain amount of range of motion in your knee to walk at a good, normal gait pattern. So you have to have a good certain range of motion. You have to have a certain amount of strength in your quadriceps and your hips and your glute muscles. You have to have a certain amount of ability to do these things with not so much pain and not so much discomfort. So what's happening is if you have these limitations, it's impacting how your body moves. And if you're impacting how your body moves, the body has to obtain that movement in some other way. So it might be a compensatory or compensation is going on to help your body move. If it's walking, if it's going up a flight of stairs, if it's standing up from a chair. So the stresses and the things that are happening have to occur and have to go through other parts of your body. So usually what's the next thing in line is your hip joint. Your hip is a very big area. It has a lot of large muscles surrounding it. It's very important for the stability of your body when you're standing, when you're sitting, when you're doing anything, when you're walking. And it's just a very intricately related part of your body when it comes to the relationship between your knee and your hip. So basically what is going on is your hip is getting all these different stresses, all these new stresses and things that are affecting it. So the things around your hip, maybe the soft tissue, maybe the tendons, the ligaments, maybe the muscles themselves, these things are getting different stresses and are being used more so than they might have been normally or before surgery. The other thing to think about is you just went through a surgery. Your body in general is in this state of recovery. So there's inflammation, more so, of course, in your knee joint, but there's inflammation throughout your body. There's sensitivity, so this hypersensitivity to pain and discomfort. As your knee heals, it's trying to protect itself. So it's trying to avoid going into these motions and things that might trigger this pain, this intensity, this signal to your body and to your brain. Well, the same thing might happen with your hip, is if your hip is having these stresses and going through these things that it's not normally used to, then it might send these signals. It might be a little hypersensitive and sending information to your brain and to your body to be more of a protective mechanism. And so that's going on as well. And then, of course, after surgery, you're rehabbing, you're recovering, and you probably might be doing more activity or different activity that your body's not used to. So those muscles, that hip muscles and the tendons and everything around your hip joint are trying to adapt to, one, you're moving probably differently, and it's always changing day to day as your body heals and your knee heals. So it's moving differently, and you're probably moving more and doing more than you typically would because you're stressing the body in order to recover, in order to heal and get back to the function and the level that you were before. So all of these things contribute to why it's very common to hear about people having hip pain and discomfort after having knee replacement surgery. So how do we manage this? What can we do about it? There's a lot of different things. So first off, you want to keep in mind that just like how your knee and your hip are intricately connected with each other, like links in a chain, so is your low back. Your low back is an extremely important aspect of your body and your movement and your mechanics and everything going on in your body. And within your low back, of course, is your central nervous system, your spinal cord, and the nerves coming out of your spinal cord throughout your legs and the rest of your body. So the big thing that I always like to do with someone who comes in complaining of pain in and around their hip or their groin or the side of their hip or their glutes is we want to take a look at the low back first. So that means a screen, probably by a physical therapist, maybe by your doctor, looking at your mobility, looking at your strength, looking at if certain movements cause pain and discomfort in your back or are causing these radiating or radicular symptoms and pain. What is the nature of the pain you're experiencing? Is it more of an achiness and a deep pain, or is it more of this pins and needles, sharp pain that might be more a sign of a nerve type of pain, something going on with your nerves traveling down your leg, a sciatica, for example? Very important to take a look at the back, screen out the back, address anything going on with the low back, the lumbar spine first, and then move on to look more specifically at your hip joint. So that's the main thing. Now, when it comes to the hip itself, so let's say that we're taking care of the low back, we're addressing things going on there. What do we want to look at the hip and around the hip itself? Well, a big thing is a lot of people, the first thing you want to do is stretch, or you want to beat it up with a foam roller, a massage stick, a lacrosse ball, whatever that may be. Because what it does is it does provide some relief oftentimes. It provides a little bit of temporary relief of that pain. It feels good. So people think that that's a good thing to do. Now, it's not necessarily bad or harmful to do this, but really what we want to focus on more and more for the long-term benefit is going to be building strength and building stability along that hip joint. Like I was saying before, there's new stresses, there's new things going on, there's new stresses going through and around that hip joint as you move differently, as you walk differently, as you increase your activity level. And so we want to build this level of strength, we want to build resilience and stability so that all these tissues, so your muscles, of course, but also your tendons and your ligaments, are able to really tolerate the activities that you're doing. Of course, most importantly, just your normal day-to-day activities like walking and going up and down stairs and getting up from a chair, but also any other activities that you want to get to be able to do. We want the hip to be able to tolerate that and not have pain and discomfort. And the best way to do that is building that strength, building that resiliency, building that tension through the muscles and tissues of your hip joint. So strengthening exercises are extremely important for the hip, both probably before you have any hip pain, if you don't have any hip pain, but also even more so if you do have hip pain and discomfort after surgery. So things like bridges, things like body weight squats, step ups, step downs, any type of lateral movements, so side steps with a band, lots of very dynamic exercises that incorporate a lot of muscle groups are going to be very important. And weight bearing, of course, is great as well. Of course, you don't have to avoid any exercises that are open chain or non-weight bearing, but those weight bearing exercises that incorporate a lot of muscle, squats, deadlifts, things like that are really great. And it doesn't mean you have to go to a gym and load up a barbell and be able to do crazy amounts of weight. There's easy ways to kind of introduce your body to these movements and progress them. So talk to a personal trainer, talk to your physical therapist, and ask them how to start doing these motions that are dynamic and incorporate a lot of strengthening. And that is really good. And the other thing that I would mention is look at things like single leg activity. So things like even initially just balancing on one foot can really engage a lot of muscles of your hip that keep your pelvis aligned, keep you stable, your glute muscles, of course. Standing on one leg, being able to balance on one leg is really a great exercise to do in and of itself. And then incorporating things like moving the opposite leg while you stand on one leg, doing maybe single leg exercises like a lunge or a goblet squat or a pistol squat is what I mean. Doing things like that to incorporate unilateral strength can be really good to provide that strength and stability through the joint. And then I would also say just look at your general movements. So the big one, of course, is going to be walking. So look at how you're walking throughout the day. Yes, people have some degree of variability in how you walk. That's very normal. That's very typical. We aren't robots. We aren't going to walk all exactly the same. So don't get stressed out or bogged down by that fact, but look at things. If there's a glaring thing that's you're walking that's just a deficit or an impairment or something your physical therapist points out, try your best to improve that. Maybe it's your stride length, so how big your steps are. Maybe it's that you're having some pelvic drop or you're tilting or leaning to the side while you're walking. Maybe it's you're limping because you still have so much pain and discomfort. Look at your movements. Look at the gross big picture of your movements and walking and things like that. And just if you see these glaring things, try your best to improve those, because if those deficits are so significant, it might be increasing that pain, increasing that stress and discomfort in your hip, as well as in your knee and other parts of your body. So take a look at those big picture things. So just to give you a brief summary, why do we get hip pain after knee replacement surgery? Well, there's different stresses, different things going on. You're moving differently. The knee's moving differently. You're healing, you're recovering, you're hypersensitive, your body is, and it's giving those pain signals. The tendons, the tissues, everything is adapting to new movements, to new stresses, and that's what probably, in most cases, is causing that pain and discomfort. What can we do to manage it? Well, first, take a look at that low back. Make sure there's nothing wrong there. Make sure we're addressing anything going on in the low back and lumbar spine. Then focus on strengthening. Build up that strength. Build up that resilience. Do things like full body, weight bearing, dynamic exercises. Do things that incorporate single leg stance, balancing on one leg with good alignment of the hips and the pelvis and the knees. And focus on the big picture of your movements in general. So looking at your walking and looking at just your general movements. And if there's glaring things that can be improved, do your best to try to improve those and try to reduce the stress and improve the efficiency of your movements as well. So thank you very much for watching, everyone. I hope this provided some helpful information for you. As always, be sure to subscribe. I post videos on a regular basis, everything related to knee replacement surgery, the surgery itself, preparation, recovery, life after knee replacement surgery, all sorts of things. Be sure to share any comments or questions. I do my best to respond and answer all of them. Have a great rest of your day and take care.